Great. I'll just do a quick little intro just for the recording, but I did want to welcome everyone to our spotlight call for November. Super glad for everyone who's able to join, and for those who will be watching the replay and checking out the recap. Thanks for checking that out as well. I know a lot of you weren't able to join at the time right now, but are looking forward to the replay. So, I mean, these spotlight calls, we've just been starting them this fall, but they're designed to give you access to leaders like Dr. Chen who are bridging the gap between sick care and well care. You know, what we're talking about, consumer-led, consumer-centered care. Like I said, a recording will be available soon. I did want to mention really quickly our next one, which we do have lined up for December. Our next spotlight call is with Wei Li Shao, the president of Omada Health. Real excited for that. He's got an update on kind of what to expect, and this might work its way into today's conversation too. I don't know about what to expect as the next wave of GLP-1 medications come out. The oral GLP-1s, which apparently are going to change things again. So I'll put the link to that one in the chat. That's December 10th. That one's coming up. So for today, our topic is purpose-driven health. Our title or our theme is engaging the motivated adult for longevity. And I wanted to welcome Dr. Chen. So today we're joined by Dr. Gordon Chen, founder of ThriveWell. I can give a quick little intro just from LinkedIn, but Dr. Chen's kind of a friend of Healthcare Rap. We've had him on the podcast 3 times over the years, and I will throw those links in down in the chat as well for those who haven't listened to all three. Always like super insightful. We generally like we only invite people back if we get a lot out of having them on, and we've always had such great conversations with them. But Dr. Chen is, like I said, he's the CEO of ThriveWell, so that's an umbrella brand of companies, and you can get into this a little bit more, Dr. Chen. But my understanding is it includes ThriveWell at Home, so that's a private duty home care company. Then there's Blue by ThriveWell, which is kind of the state of the art health, wellness, and longevity center. So these are all just kind of pieces of it, but here's how the format will work today. So we'll give Dr. Chen a good 15, 20 minutes. We're totally flexible on that time. If we need more time for that portion, then we can totally do that. My understanding is you have a bit of a presentation or just kind of a conversation to share with us, and then we'll open it up for our town hall discussion portion, which is a just totally open-ended Q&A conversation portion. That can go as long as we want. We have it scheduled for 45 minutes total. We can go a little bit more or less if we need, and we can also provide questions, later on and have those answered if we need. So that's kind of how it'll work. And I just want to thank everyone for joining again. Like, you can feel free if you want to put questions in the chat during the presentation portion, before that town hall portion opens up. But I have a feeling we're going to be pretty interactive during the time. So please do utilize the chat function as we go. With that, I'll turn it over to Dr. Chen, and thanks for joining us.
All right. Thank you, Jared, and pleasure to be on as a repeat guest over and over again. Love our conversations and happy to share what we're doing at ThriveWell and in particular at Blue. I do have a presentation, not a lot of slides. Since this is a tight group, I'd love for this to be interactive. So feel free to use the chat. If you want to come off mute, we can have a discussion, or maybe that's more for the interactive time. That's fine as well. Let me go ahead and so I'll be eyeing the chat, but let me go ahead and share my screen. Can you all see that? Try to. Can you give me I lost view of the chat, but can you guys give me a thumbs up if you can see this? Okay, fantastic. All right. So Jared, since I'm going to try to get the chat back, here you go. All right. So we're going to be talking about not only purpose-driven health, right? But what I believe is the next evolution of where we need to go to get people to live to their fullest potential from a health span perspective. Jared had mentioned ThriveWell is our umbrella company. Blue is really where my wife and I, Jessica and I, spend most of our time. Um, and the intent of Blue is to create a longevity community, one where it's common for people to live to over 100 healthy with purpose and in community. Blue stands for bringing longevity to you. And so we'll talk about, how we're going to achieve that, what we're already seeing today. But I want to give a little bit more background. Okay. And so I don't know how many of y'all have kind of heard of Chen Med, maybe either thumbs up or enter in in the chat. Yeah. Okay. So Chen Med is our family's company. I spent the last 2 decades, operating Chen Med as chief medical officer. My wife was chief clinical officer. I'm the big Chinese guy on the right, not the one on the left, which is my brother. We're both cardiologists. A lot of people think we look like twins. And so basically, we work together as a family, like building Chen Med from one center to over 130 in 14 states. What was remarkable about our learning in Chen Med is it's very uncommon for physicians to know how to influence outcomes and to take accountability for someone else's health outcomes. So we had to learn it. We had to learn it. It's also very difficult to improve health outcomes unless you really learn how to not only create strong relationships between providers and patients, but you really learn how to change their behavior, right? And so healthcare today is really not about behavior change. And what we learned in Chen Med in order to improve our patients' outcomes, we had to really crack that nut, first starting with the physicians, working on physician mindset and investing in their own personal leadership development. And they need to learn how to lead themselves before they can lead others, right? And then now that they have that base of influence, and how do you get them to help patients to make those changes, sustain those changes? And what we're seeing with our Chen Med patients is about 5 to 7 more years of life, 30 to 50% reduction in hospitalizations, um, and taking care of 200,000 patients across the U.S. And so being able to replicate the outcomes just at scale, that was something that I think was pretty unique to what we had learned how to do at Chen Med, right? So scaling is one thing, scaling outcomes improvement is another thing. And then obviously in a full risk model, if you can reduce hospitalizations 30 to 50%, you have more capital to deploy towards growth, towards prevention, towards technology. And I think that was that was part of our differentiators. Jessica and I, we heavily focus on the physician component. So all of the physicians, the physician leaders, quality, utilization management, even talent. We had like 40 recruiters reporting to us, right? We had that reporting to us, and then our physicians essentially were accountable for managing their patients and their P&L. And so that's our background. Let me kind of move forward. I'm sure people saw the 60 Minutes recently, right? Did everyone see this or know or heard of this book called Outlive and Peter Attia, right? And there's this movement. Now he's got 75 members, right? That he's taken care of for, 6 figures, right? I think that's what he said. And there are a lot of things that Peter Attia is doing that we said, wow, that's great. Not only is it great, we're thinking the same thing. How do we not focus on a reactive care model? How do we focus on what's possible? How do we optimize health span? And we'll talk more about what that looks like. And so Jessica and I, when we stepped out of our Chen Med operating roles, and I gotta say, like by like just thank God that we had the opportunity to not only step out, but then really study what was happening in the industry, but then also become experts ourselves at this whole concept of health span optimization. Look at the data, like what actually has good evidence behind it and what doesn't. There's so much noise out there in health, wellness, and longevity, right? So we had to sift through from a physician lens and a physician leader lens, saying, hey, what do we want to incorporate into our longevity community, and what do we think is not quite ready for prime time, right? So we went hard at this whole data review, and then that's how we kind of structured the service offerings that we have at Blue. Okay. Let me pause. I'm just looking at the chat. I'm not seeing any questions, so I'm just gonna power forward. Yeah. So this is probably a slide that many of you will have seen. If you were to guess the ages, but you can see them here. But if you were to guess, you're like, whoo, the slide on the left, or the photo on the left and the photo on the right, they look pretty darn similar, and they're separated by about 3 decades, right? And then you look at the slide in the middle, you're like, ooh, that doesn't look good. And so this is a hint that we don't just have to guess and look at diagnoses and say, oh, how long is someone going to live? We can actually look at body composition and say, ooh, the one on the right is going to be way healthier than the one in the middle. Everyone see that, right? Not only from a human perspective, you look at body composition, you say, ooh, they're different. They're both humans. All three of them are humans, but they're very different. Then you think about the quality of the animal products that we consume in America. You say, what's the quality of the chicken, of the steak, of the, is it good quality or is it bad quality? Is chicken chicken? No, it's probably not, right? Is steak steak? No, probably not. And so you start to think, ooh, what are we like? What, are we consuming high quality foods? Are we consuming like morbidly obese, inflammatory, diabetic type of, animal products? And so I'll let you answer that. But this just, it's so clear that we need to take a better look at the quality of and the composition of not only our own bodies, but what we eat. Okay. Any questions here? All right. So now, as we looked at the data, we basically said, what's possible, right? We've moved the needle 5 to 7 years for our, old, poor, sick patients in Chen, right? Underserved communities, very difficult to engage and influence. And we said, well, what if we started earlier? What if we could go broader? What's the art of the possible? And just this study that shows these 5 things lead to 12 plus more healthy years. Goodness gracious. If just these 5 things, it's not a question of knowing what to do, it's a question of implementation, which as leaders in healthcare, we all know that that's the issue. It's not a lack of data or a lack of ideas. It's a lack of execution and delivery, right? How do you actually take what we know to be true, and how do you actually execute upon it? So we realize that of what's possible, 12 plus years, by the way, that's just 14 years for women. It was even higher for women. That's even before you talk about the evidence-based longevity medicine, genetic testing, all of the advances, coaching, this is just the blocking and tackling. Wow. So we realize there are 10 to 20 healthy years on the table for each of us. Think about that. Think about what you would do. Think about what you would do with 1 to 2 decades of healthy life. Just think for a moment. Think about the last 10 years of your life and think, what if I had an extra 2 of those? Think about what you could accomplish. Think about the purpose. Think about your impact, right? So this is very meaningful. So this is what motivated Jessica and I with our background in Chen Med and seeing that, hey, we can do this. We can transform healthcare. We can transform communities. We can help people live longer. And then now let's go upstream and let's figure out how to do it. Imagine if we had everything that we needed to help people to live to their fullest potential. Okay. So um, this is why we started Blue. And we said for Blue to exist, we need really a combination of things. Okay. We need evidence-based longevity medicine. It's got to be trusted. It can't just be pushing hormones or supplements, right? Or it can't just be a marketing. It's got to actually work, right? What we learned at ChenMed is we needed to deliver outcomes and results, otherwise it wouldn't scale, right? It wouldn't scale if it doesn't work. So just like we're thinking about that for Blue, we actually need to add years to people's lives. That's core to who we are. That's actually part of our purpose, like why we want to do this with our time, right? And if we can actually make it work, it's got to be evidence-based. Because if you're going to follow the evidence, it'll help you to know what we should be doing and what we shouldn't be doing rather than guessing. Like everyone's just guessing now. What's on social media? What do I eat? Or do I do intermittent fasting or do I do not? Or do I do this diet, carnivore diet, or this paleo? All of these different diets, it's confusing. So we need evidence to support it and not just guess. Make sense? Yeah. In the middle, we're like the line between fitness and medicine or health, wellness, recovery, there can't be a line between them. Actually, when I wrote an article about this, I said, what a personal trainer does is actually more aligned to health and wellness and driving health outcomes than what a physician does because they're trying to optimize. Physicians are just trying to get you back to passing. Healthcare is trying to get you back to passing. Otherwise, insurance doesn't cover optimization. Insurance only covers when you're failing, not when you're not to get you to optimize, to maximize potential. Okay. Trainers are thinking about maximizing potential. So I went out and I said, what's the fanciest personal training certification you can get? I got to learn about this because we need to bridge the gap between healthcare and personal training. So I went out and got a National Academy of Sports Medicine personal training certification, right? I probably was maybe the only cardiologist that like signed up for that and completed the training. But I said, we got to understand what's happening here. Then we built a culture to say, hey, can we recruit, hire, and train the best of the best trainers to deliver results like improve VO2 max and reduce visceral fat and increase muscle mass, all the things that are aligned to longevity. So we said, all right, we did that. We had 50 applicants for every one spot. And so that was core to our model, okay? And it is core to our model. And of course, if we can exercise and we can recover better, then the cycle time of improvement shortens and you can get greater results with less effort. And this is why our members are like, hey, Gordon, I encourage them to call me Gordon, not Dr. Chen, right? Like, you've made health easy. If we can make health easy, then it's a game changer. Okay? It's a game changer. The last component is community. And so this is part of what I think is missing, relationships, community, and the lift of doing things together. It's not just a one-on-one relationship between a doctor and a patient. No, it's the community lift. Like healthcare completely misses that. A lot of the longevity experts are trying to do this, but they don't really know how. I think online communities are better than nothing, but like what would be even better is meeting in person, right? Being around other humans, creating those relationships that like we're designed to be in community. And so everything that we built out here was to help people to come together and then be like-minded and pursuing health, wellness, longevity, optimizing their health span, but doing it together. Seeing some questions here. Sleep. Well, James, we'll get to sleep in just a minute. It's super important. Super important. It's on my next slide. 10 more years of seeing your grandchildren, Drake. I love that. And so each of our members we actually ask them, I say, well, what's your health span vision? Think about your own health span vision. Like, is it a number? Is it an event? Is it seeing your grandchildren get married or have their own kids? Like, like what's the vision for your health span? Important. We all do it in business. We don't do it for our own lives. So we ask our members that and they all like, they go, oh, no one's ever asked me that before, right? What's your purpose? Can you articulate your purpose? So I mean, I'll share my purpose, and obviously this is personal, right? I'm not trying to push my purpose on other people, but my purpose is to glorify God by bringing more love and better health to those we serve. So I get energized by spreading love and health in a way that honors our Creator, right? Like that gives me energy. And so, but that's an important question for longevity, right? If you're not living with purpose, if you don't have a health span vision, then you're drifting. Okay. Um, so how do you deal with skepticism, especially if the best evidence is okay? That's a great question too. So already what we're seeing, basically you take the things that most strongly correlate with longevity, right? And I'll go through them. But then you look at the change and you say, hey, we're not going to wait like a lifetime for the results to come out, but we have to look at surrogate indicators. And so for every 2 points that you can improve someone's VO2 max, normally it goes down as you age. You improve it, you're breaking the curve, right? The bending the curve. For every 2 points that you increase VO2 max, you decrease risk of death by 10%. So that's a good way. Oh, what else is a good way? You lower visceral fat, you drop cardiovascular disease risk. Simple as that. Cardiovascular disease, number one killer. So how do we improve what we call vitality measures? And I'll share with you our results. It's actually been incredible learning. Okay. So back to James's question. Okay. Um, this I'm not going to spend that much time on. Just everyone, I think, and actually, well, stop me if we should go deeper into health span versus lifespan. Like nobody wants to just increase their lifespan without increasing their health span, right? Because you want quality years, right? And so what we call an additional year of health span, we call that a thrive year. Okay. Additional year of health span achieved by pursuing optimized health, wellness, and purpose. See that word purpose back in there, right? That's what we call a thrive year. So our intent, our vision is to bring purpose, longevity, and 20,000 thrive years to each community we serve. Right? So that's what we're trying to do. We're trying to push health span out. And of course, lifespan generally pushes out too, but we don't necessarily want a lot of time between health span and lifespan, right? We want as much time as we can of health span. Okay, any questions here? This is just all right. So then you're like, Gordon, how do you do it? Everyone can talk about it, show me the results, and show me the strategy. Like, right? So what we do is we start with the 5 drivers of health and wellness. Okay. And, I was presenting at the Alliance of Aging, and everyone was like, like taking their phone out, taking pictures of this. I mean, this is about 80% of the answer that everyone skips over, right? Who in healthcare is talking about purpose, their priorities, their plan, a life plan? Like we talked about a health span vision. So if we don't have a vision for health, how are we going to get there? We don't know where we're trying to get to, right? Got to start with what we call personal health and wellness. And we try to make it easy for people to kind of remember purpose, priorities, and plan. Critical. Okay. The community piece. Who's talking about community? Not real community. Community that's engaging, encouraging, empowering, not how many likes you get, right? That's not a real community. Um, like do we have a community that is engaging? They're showing up for each other. That's encouraging, right? That's important and empowering, right? Very, very important. Physical. Are we winning where it matters the most? Sleep, steps, and strength. Are we tracking sleep? Are we optimizing that deep sleep? Are we giving enough time for our lymphatic system to get all the junk out of our, of our brain, right? Prevent dementia. It's very important. A lot of data coming out on the quality of deep sleep with decreasing dementia risk, right? Steps and strength, we know that, but how are we holding each other accountable to it? Are we actually getting stronger? What's happening to our muscle mass? We don't know. We're not measuring it. Okay, so that's why we got this fancy machine called a lunar iDEXA to measure body composition. If a DEXA is a gold standard for body composition, a lunar iDEXA is 40% more sensitive and specific for changes over time. And so we have, there are only a few of these in South Florida. Two of the three, two of them are in academic research institutions, and the other one's in, here at Blue, right? Because we need the data to know muscle going up or down. You need muscle and you need bone for longevity, right? And then of course, visceral fat. We talk about nutritional approach. Now it doesn't matter what people's opinion is on what the right foods to eat. Just look at the data. Look at your own data. Is what you're eating increasing your visceral fat over time or decreasing your visceral fat over time? Simple. So, I'm on a carnivore diet. Okay, what's going to happen to your visceral fat? Goodness, it's going to be like through the roof. You lose fat, but your visceral fat's going up. You're going to get a heart attack. It's just very simple, right? And so for us, for our members, it's very empowering to say, hey, you don't have to take my word for it. You're going to get rescanned and you're going to see what happens to your own results. Now, the beautiful thing is with our approach, from a data and evidence perspective, we've seen in 3 to 6 months, 0.5 pound of visceral fat reduction across the board, as high as 2.5 pounds of visceral fat obliterated. My visceral fat is 0.00. And it was 0.09, and I made tweaks, and I got it to 0. Okay. So anyways, it's totally possible to drop visceral fat completely to 0. I personally think as a cardiologist, it's way better than cholesterol as a measure of heart disease risk. The correlation's stronger because you can drive it to 0. You don't need it. You need cholesterol. Okay. Lastly, the spiritual component, meditation, mindfulness, and motivation, super important. So just think if we address these 5 things, how much of chronic disease, illness, mental health would just disappear. But we don't focus on that in general. We do at Blue, but healthcare doesn't, right? I'm just looking here. What more can you accomplish? Let's see. Once you have been diagnosed with cancer or heart failure, but not much before. Like heart failure, we've seen at Chen Med, heart failure patients, we can completely prevent hospitalizations. Heart failure can be managed exquisitely well. And so I don't think that is much of a limitation. Depends upon like the stage, the class of heart failure. Cancer, obviously cancer is like a big X factor. Now, a lot of things, as you're focusing on these 5 things, cancer risk goes down dramatically. Even if by reducing the visceral fat, you're reducing the inflammation, you also reduce the cancer risk, just by adding, more of a plant-based diet. How do I start a conversation with my Harvard-trained PCP on ideas like this of getting them resistant? This is from James. So, I didn't learn this in my training. As a cardiologist, I had 1 hour of nutrition training. Peter Attia talked about this too. You get like all these physicians that they don't know how to influence outcomes. They know how to write prescriptions. They know how to write referrals. They don't know how to do behavior change. That's why at Chen Med, we had all of these attendings. We said, you're not ready to see our Chen Med patients yet until you go through all of our Chen training, and we taught them how to lead themselves, lead others, look at the data, look at the impact of lifestyle management. Um, and so I wouldn't try. I mean, like my guess is any PCP has like 15 minutes with someone and they're trying to do like a gajillion amount of things. Like they don't have capacity to learn this stuff. They're just trying to survive. And so the question that you should be asking yourself, James, is is a pass-fail mechanism for stewarding your health span sufficient? And my guess is probably not, right? The existing healthcare system needs to be disrupted. And so it's great if you're about to die. You go to the ER, go to the hospital. That's what it's designed for. And we know that the hospitals have subsequently then bought up and influenced the rest of healthcare. So it's all about, making the facility sustainable. We need hospitals, right? But they're not about health span optimization. You just you have to you can't go to Apple to buy a car, right? You go to Apple to have other, right? But if you can't go to anyways. You guys get the analogy. So let's keep it going. So this um, this is our strategy. Saying, Gordon, well, how are you going to do it? Well, we're going to start with the five drivers. We're going to understand that's 80% of the answer. And we're not going to poo-poo it. We're actually going to build everything, our processes, our facility, our engagement around the five drivers to optimize that. Then we're going to do all of the fancy medical testing, genetic testing, biomarkers, CGMs, 24-hour ambulatory blood pressure monitoring. We're going to dive deep into the medical records, but not just for testing for the sake of testing. We're going to actually identify what the top five risks are for each individual, and then we're going to go after those risks. And the risks are not going to be a 5 or 10 year like timeline. It's going to be the risk against your greatest health span vision. So if you want to live to 100 healthy, what are the top five things that would get in the way of that? And how do we look at all the data that we can gather and, have AI and expert clinical judgment come together and identify those five things, and then we come up with a plan to just completely reduce the risk of those five things. Okay? Just like we would with any good strategy from a business perspective. And then the last on the right, we call vitality measures. And this is back to what we're talking about, the five things that most strongly relate to longevity. So you don't have to wait till, you get like real hard outcomes, and like, you don't have to wait like 4 decades until you get real hard outcomes. You can actually look at these five things. If you look at the literature, these are the five things that most strongly correlate with longevity, healthy longevity. And then you move the needle on them. And so just in 3 to 6 months, our average member increases their VO2 max 5 to 8 points. That's incredible. So an 8 point increase in VO2 max equates to, I don't know if you guys remember that stat, like 2 points reduces risk of death by 10%, right? So an 8 point improvement in VO2 max reduces risk of death by 40%. That's powerful. That's what we're seeing early on. Lean muscle mass, obviously you got to track that over time. So we have the fancy lunar IDEXA, visceral fat, same thing. We talked about that. Balance and mobility, very important as we get older, and grip strength. Okay. Um, is there a cohort or demographic that seems more receptive to optimizing their health span? Well, I mean, we are here are some of our results just so you can see. Just it's been pretty incredible, right? It's just over time. This is like a 3 to 6 month window. Visceral fat down, VO2 max up. Doesn't matter kind of where their starting point is. You can see we've had some folks start with visceral fat like almost 5 pounds, and then it just comes down pretty aggressively. Same with VO2 max. We're gonna publish these. We're working with some academic institutions to publish them. Got to be data driven. Okay. let me just try to finish up here and then we can get the questions. Okay, good. So, yeah, if anyone has any questions or want to check out our website, you can scan the QR code, um, and then I can get to some of these questions. So, Jared, your question, um, so we are not covered by insurance. So, people need to pay, out of pocket. So, there is some selection bias, right? Although we do, we do have about 10% of our members we kind of gift the memberships to. So I think people that want help, it's just like any coaching program. You have to have the potential to improve. Now, almost all of our members have the potential. You have to want to improve, and you have to have and make time to improve. So with those three things, we see just incredible results. Now, we're seeing a lot of people that have gotten stuck with healthcare before and they have no alternative and they want to do better. They're just not getting the results that they can with existing healthcare. And so they're like it's time to invest in my health. It's like time is ticking. We got to go. And then we just see tremendous progress. We've also seen folks that we discover things on the genetic testing, and all of a sudden it's just like the missing link. Oh, you needed methylated vitamins because your genotype doesn't absorb the existing or you are missing this part of your training regimen, or you learn how you respond to VO2 max training and what's the best recovery. You learn that from your genetics. And then so they just start seeing amazing results. And then once you see the results, it compounds itself, right? Because if you show people an easier way, even if it's 20% easier than what it used to be, it feels so much easier. It's like a huge lift. And then when you see the results, and then you benchmark the results every time, like with the VO2 max testing and the repeat lunar IDEXA, then you create a new baseline. And so that's very powerful. So you don't see as much of the yo-yoing. Okay. Um, let's see. Assume it's not all linear. Wait, did I miss one? So Jared, did I answer your question? This is people that can afford spending at least $6,000 on their health per year. Now I would ask it the opposite question, like, can people afford not to focus on their health? Right? I mean, it's just, and like our medical membership started at 6,000, and we're seeing a lot of interest, people just flying in from all over the country too. Um, so let's see, cohort guessing advanced audience. Yes, Layla. Um, yeah, our members, they want their data and they want results, but they're great people, right? But they just, who doesn't want results? Linear, if you're poor health versus sounds good effective. We're seeing both. So we're seeing people go from good to great, Scott. We just had two members just sign up and they're in great health, but they want to take it to the next level. So think of it as like, all right, you're a college athlete and you want to go to the Olympics. Hey, sign on. Let's go. And now I'm not saying that we have that age group. I'm saying that the mentality of thinking of like leveling up, like going from college to the pros or whatnot, right? Or if folks have a lot of chronic conditions and they want to reverse the chronic conditions, sign up. They both are doing well. Actually, we're seeing dramatic results in both groups. Even healthy people, quote unquote, right? Because healthy is all relative. Like we go for optimal. But we've seen folks that have been quote unquote healthy. They come in, they start our program, they cut their visceral fat in half. Go from a pound of visceral fat to half a pound is a huge impact. You reduce all that inflammation in your system, and it just you immediately cut your heart disease risk. Um, let's see. Tell us more about the facility that you recently opened. Yeah, so this is what we have here at Blue in Fort Lauderdale. It's a 20,000 square foot facility. It's state of the art. We've got a medical sanctuary with all of the, we need to help our members from a medical standpoint. And we do executive physicals, but it's different than like a, 1 day executive health program where nothing changes. You do a lot of testing. We do the testing, but we're all about behavior change. So all of our members, it's a longitudinal process, and then they at minimum have monthly longevity coaching sessions with multiple different touch points along the way. And we intentionally don't overload the information in the first day. We just start with re-establishing the relationship with food. All of our members have CGMs, resting metabolic rate, all of the blood work done, but we do that in the beginning. And then the first 2 weeks is just dedicated to reestablishing the relationship with food. And then they come back for their VO2 max and they, lunar DEXA, executive physical, and we review the labs, and then we prep for the genetic testing. We kind of like, you have to go one step at a time. What we learned at Chen Med, so you overload people with information, nothing changes because they don't know what to prioritize. So you have to actually prioritize the learning so that you can maximize the impact. So let's see. Yeah, so the facility recently, we had our grand opening about 6 weeks ago, but we did our soft launch and our hard launch before then. That's a bigger facility. The medical members, we've been operational for the whole year. So we're actually our first member was about a year ago, and they're they couldn't be happier. Our initial crop of members, and so they're signing up. We imagine this as a lifelong partnership with them, that we are taking accountability with them for their health span. With my crappy insurance, I'm at least, yeah. So there's a better way to invest that 6,000, Scott. And actually, what we realized, and this is, I know this is, I might as well just put it out there. We are increasing our prices in 26 because the amount of service that we're providing, there was like no margin with the 6K, like with the longevity coaching, all the testing, all the stuff that we do. And so we're like, all right, like we had such a good result, but we'll keep the 6,000 till the end of the year, just an FYI. But it is, it's an intensive model in terms of like how to operationalize it. It's helpful that we had the 20 years of experience, recruiting, hiring, training the right physicians and focusing on outcomes. That's where I think a lot of people will struggle because our experience is very few people know how to take accountability and move the needle on outcomes. A lot of people can do the testing. Not a lot of people can take accountability and help people champion the changes. Employee benefit package, James. So what's very interesting is we're having a lot of executives. We're having two things are interesting. A lot of physicians are signing up. I was interviewing a physician for a future role next year because I'm trying to get ahead of things because I see the growth coming. And in the middle of the interview, the physician says to one of our other executives, should I get this testing done? And our executive's like, yeah, I think everyone should get this testing. It's so insightful. It's like life-changing. And in between interviews, signed up for membership. It never happened to me before. I'm probably hired hundreds and hundreds of doctors, right? But it was so interesting that I was like, once you explain the science and methodology, so we're seeing a lot of physicians sign up. We're seeing a lot of executives sign up that subsequently want their whole executive team to sign up because if they're self-insured, the health wellness culture starts from the top. So if the executive team is engaged and understands how to influence health and they need it like our support, then they're like, hey, how do we make this a company benefit? The retention goes through the roof, right, for executives, because now if they're engaged with Blue and we're not only taking care of all of their the medical needs, but there's a fitness component there, right? And they feel a lot of love and appreciation. So we're seeing a lot of interest with executives and kind of like a perk for executives. And then they're comparing and contrasting with existing executive health programs. So like I've been doing this program, X, I won't name the names, but all the 1 day programs, and like nothing changes. So like you're not getting healthier if nothing changes. And there tends not to be any follow-up between those 1 day intensive evaluations. I've done some of them too, and I try to like reach out to the doc, and it's like crickets. Right. Um, so anyways, scale. Well, so what's interesting, different than Chen Med, where we had to go across the country into neighborhoods. For this, people are flying in from all over the place. Um, but certainly we have a vision for impacting multiple communities, creating longevity communities, wherever there's a population that wants it. And so the idea is definitely to expand, scale. I know a lot of folks are in Boston. We already do have folks flying down from Boston. Um, but um, but yeah, that's the intention. But obviously we need to learn as much as we can from this first site. Fill it up. It's filling up, very nicely. And then expand. We'd love to disrupt how I don't really call this healthcare because it's so much broader than that. But I want to reinvent how people pursue health. And I want it to be more accessible than just the 75 people that Peter Attia has seen, right? Um, and so I think that there is a way for employee health, to invest here versus in GLP-1s or both, or, a combination of both, but it's pretty darn expensive. And there could be a better way to invest in long-term health, right? All right, let me pause. Said a lot, and I'll stop sharing. Did I go over, Jared? Sorry, I just kept on
I'm
talking.
not even paying
Kind of
attention to the
flag me
time.
down.
No, that was fantastic. Uh, like you can kind of see from the questions, right? You have a lot of healthcare based questions as we're looking, all of us here on the call are looking to the future of looking what does come next and looking personally for how this is consumer led health. Totally agree with the sentiment of it. This is bigger than healthcare. This is how do people pursue their health, and I just want to thank you for your time. I think I want to thank everyone for their participation too. Uh, the topic is so important. Uh, yeah, I won't go into my own personal health journey either. We're each on one, so it's fantastic. Uh, we'll encourage everyone to just stay engaged. Like I said, like we'll have the recap. A couple of you all joined after probably we shared this at the beginning. We will have a recap and a replay of this whole session, so you can hear the full thing if you weren't able to. And in the meantime, I'm guessing we could find a way if people have questions after this, Gordon, to have people, for me to be able to share those with you, pass them along if people do have questions later, that kind of thing. And in the meantime, I threw the links in the chat for those previous podcast appearances for people to hear those because they've formed a foundation for where you are now, which is really cool, for where things have come from.
Yeah, you can kind of track the learning journey. I would say if you're interested in learning more, uh, you know, sign up for our newsletter. We're going to continue to kind of create almost like a inside view of what we're doing with our newsletter. You could visit our website, bluebythrivewell.com. BLU, just B, no E, BLU by ThriveWell.com. You can also, shoot me an email, gchen@thrivewell.com. I don't know if maybe I'll put that in the chat or someone can chat that in there.
That's
Gchen
it.
at thrivewell.com. I know this is a tight group, so just feel free to email me and happy to thanks, Jared. Happy to engage and support. All right.
Really appreciate your time. I know you got a lot going on, and on behalf of the community, we'll say thanks for joining us again, and and giving us a vision of what's possible.
Fantastic. All right. Great to see you, everyone. Thank
Thanks,
you.
everyone.